It's Mental Health Awareness Month, and we talk a lot about mental health for adults, but what about children? Now, we want to discuss that in this conversation as part of our Road to Recovery segment sponsored by Wells Fargo. We're joined now by Dr. Helen Egger and Rebecca Egger, founders of the pediatric mental health company Little Otter. So I'm curious to know, and I'm going to start here with you, Dr. Egger, why is pediatric mental health so important? Is it only for children that have experienced some kind of trauma, or is it, as we say for adults, really for everyone?
Yeah, mental health, just like for adults, is very common. So 1 out of 5 children have an impairing mental health disorder, and that is children from ages 2 to 18. And the real reason that we founded Little Otter is that we've been in a mental health crisis even before COVID hit. Only 20% of children with an impairing mental health disorder get any kind of mental health care, and that really is not acceptable.
And Rebecca, can you share with us how you can help the younger set digitally? Because I think, they're very savvy when it comes to technology, but when it comes to things like doctor's appointments, I think we think adults would be able to handle it a little bit better. So how are you dealing with that balance of, kids getting the most out of digital care in this space?
Yeah, so we are really focused on a family-centered approach. So bringing in parents for every step of the process, and making sure that we're hiring providers who are excellent at providing virtual care. So we actually see providing virtual care to be an asset and something that we think means that we can provide care in a child's and family's home, and give them exactly what they need when they need it.
I'm curious to know how pediatric mental health isn't just good for children, but also for the parents and also just for the families.
Absolutely.
Helen, I'll let you take that.
I'll take that. Yeah. So we say, that first of all, there's no health without mental health, and that any child mental health is really fully linked to the family's mental health. So first of all, we know that when parents are struggling, either in their role as parents or themselves having challenging mental health problems, that's going to have a huge impact on their children. We also know that if the parents of a child are not getting along and their relationship has a lot of discord, that it's going to be hard for them to align as parents to help their kids. So that's why at Little Otter, we provide parenting specialists to focus on supporting parents and kids on day-to-day parenting challenges. We have therapists providing mental health care to kids 2 to 12 years old. And then we also provide couples counseling. Again, our focus at Little Otter is on what is needed to support the whole family's mental health. And the other thing that's important about that is we're not saying, here's the problem child. There isn't ever just a problem child. This is really about a whole family and about what everyone needs.
That's so true, right? I mean, you have to have support, that support system for the whole family.
Absolutely.
Rebecca, I know that you all took a big step forward here with Little Otter in closing a funding round for $4.2 million. I see it's a pre-seed and seed funding round led by Torch Capital. Tell us how you hope to put that capital to use.
Yeah, well, most of it went to, our successful launch that we're doing today. And we're focusing on making sure that our product is amazing for families in California so we can start to expand across the U.S. and reach all of the families who need us. We know how big the mental health crisis is, especially because of the pandemic, and we're looking to support more families.
I'm curious to know, and this is to both of you, perhaps, Doctor, you can go first, as you were just mentioning, Rebecca, about how the pandemic really just brought to light so many mental health issues that people need to pay attention to. Curious to know if there were any challenges as you both went out to secure that type of funding as founders, some of the hurdles that you both faced.
Yeah, well, I'll start and then toss it to Rebecca, because I think the first piece is that there certainly are increased mental health needs because of the pandemic, but the pandemic also really showed us, both in the medical field and the mental health field, as well as for consumers, that telemedicine works and that telepsychiatry works. Before joining Little Otter, I was chair of child psychiatry at NYU Langone, so I have a lot of experience on how to deliver high quality telecare. So in some ways, we think that there were advantages of this us starting Little Otter during the pandemic, because people finally really understood that teletherapy works.
And I would also love to add to that, it's also helped in our relationship with providers and hiring providers, because they're more comfortable with providing high quality telemedicine services. So I think it's been a huge benefit. We always wanted to be fully virtual. We felt like that was the only way to reach the amount of families who needed our care. But we definitely got some tailwinds because of this year.
All right, Dr. Helen Egger, Rebecca Egger, founders of Little Otter, thank you both so much for joining us today about this very important topic as Mental Health Awareness Month kicks off.